Hello and welcome. I'm Montserrat at the Yoga Therapy Institute. And today I'm going to share with you the next yoga therapy tool in our yoga therapy toolbox, which is actually something to do with how to create a safe space when we're working with a client who's been diagnosed with cancer or going through cancer treatment. Now, the number one rule that I always ask of myself is to make sure that I don't focus on the diagnosis and that I don't focus on that person as the person with cancer. So you really need to turn the tables around, and rather than look at the person, to look at yourself and think, okay, how does these diagnosis affect me, especially if you've just started working with people diagnosed with cancer or going through cancer treatment. You may feel overwhelmed and you may over focus on the topic of cancer when actually you have a whole human being in front of you. I once invited a client of mine who had been diagnosed with cancer, went through cancer treatment, and we worked together with the support of yoga therapy until remission. And a year or 2 years after she'd gone into remission, I invited her to speak to some of the students at the Yoga Therapy Institute. One of the students asked her and said, "Hey, what did you do with Montserrat in the yoga therapy sessions when you were going through cancer treatment?" And this client took a moment to think about it and said, "Well, we moved." And she did this movement, meaning that we really didn't move a lot. We actually moved in terms of joint freeing series, some slow movements, some, gentle movements. Yeah. So she said, "We moved, we laughed, and I slept." This was her response. And then we all laughed and we said, "Well, yeah." And then I turned around and I said, "Well, actually," sorry, but yeah, when we were working together, and of course she was going through the cancer treatment, sometimes she was absolutely exhausted. The fatigue was incredible. And I'll share some insights one day. And some of my students know when I teach that I share that how I went to pick her up from her house. I do that with some clients to bring them to the studio because they're so tired from the chemo that they can barely move. But apart from that, I said to her, "Well, when you were going towards the end of your treatment and you were recovering," I said, "we even did downward dog, right? Okay." And then we were laughing. So where am I going to with this? Well, yes, we moved. Yeah, we did some breathing practices. We laughed. We joked. And she slept. I gave her a place where, with a restorative practice and a nicely guided yoga nidra, where she could actually have a little snooze because she was really stressed and so therefore and worried. And sometimes it was difficult to sleep at night. And this is what she took away from our sessions, that there was a human to human relationship, not a human to a human with cancer relationship. Yes. So we connected in the levels of humanity rather than on the levels of disease. And this is something that's going to be really my true recommendation for you. And that is, if you work with somebody, it could be a diagnosis of cancer, or it could be another very significant diagnosis. Do not focus on that health issue. Do not focus on that diagnosis. Although you have to take into consideration the contraindications, the practices that are adapted to that person, but focus and but let's not focus, let's just open and widen the focus onto that human being that you're going to be working with and you're going to build up that relationship with. That is the core, the essence of safety, rather than focusing on, "Oh my God, this person is really sick." And maybe perhaps think about it, you are feeling overwhelmed by their diagnosis. This is something to reflect on. I hope that you find this insight a little bit helpful. As always, it comes from clinical experience. Please, welcoming your questions, any comments that you have. And if it resonates with you, please, I'd love to hear from you. Take care, and I'll see you next time.